Hi everybody, it's Brittany. So today I'm going to go over 3 key differences between a naturopath and a homeopath. The two professions are very similar, and probably the number one question I get over and over and over again is a homeopath a naturopath? Is a naturopath a homeopath? How are they different? Aren't they the same thing? And so they are very similar, and I'll tell you why. So homeopathy is a standalone system of medicine, meaning it's got its own philosophy, its own way of treating, its own way of seeing disease. And so theoretically you could use homeopathy to treat basically anything because it's this full standalone system of medicine. Because no matter what you come in with, there is a potential remedy to help you. Naturopaths, in contrast, have a lot of different types of medicine in their toolkit. So homeopathy is one of the things naturopaths will use, which is why it's so confusing, because you can go to a naturopath, they can do acupuncture, they can do cupping, they can do lifestyle stuff, they can do supplements, some of them even do chiropractic adjustments, and they could give you a homeopathic remedy. But if you go to a homeopath, you're really only going to get a homeopathic remedy. Sometimes you will also get a supplement here or there if the homeopath really feels it's helpful. They might also be trained in other types of therapies, and so they might offer something else. But in general, if you go to a homeopath, you're going to get a homeopathic remedy. I like to think of it as similar to Chinese medicine in this way. So if you think about it, Chinese medicine is or any sort of traditional medicine has its own way of looking at disease and health. And so you go in, no matter what you have, they are going to have a perspective on how you could get better, and they're going to give you something that is like, if you go to a Chinese medicine doctor, they're going to give you Chinese medicine. You wouldn't expect them to do a chiropractic adjustment, really, right? So if you go to a homeopath, it's the same thing. No matter what you have, they are going to have a specific way of looking at it, and they're going to have a remedy that could help, and it will be a homeopathic remedy. So because a naturopath is trained in so many different things, you don't necessarily know beforehand what kind of medicine you're going to get. That's fine, and a lot of naturopaths are fantastic homeopaths or fantastic Chinese medicine doctors. But if you are looking for something in particular, I would reach out to whatever naturopath you are considering going to and maybe seeing what types of therapies they offer, because not all of them do all of the different therapies they're trained in, right? Because it's just so many different things to be good at, if that makes sense. Like you have to, I know very few naturopaths who really feel comfortable with all different types of therapies they're trained in. Usually they'll choose one or two that they feel work really well and that they're really comfortable with, and those are the ones they're going to use to treat their patients, right? Which just makes sense. So the second large difference between a homeopath and a naturopath is very similar to the first, and that's really their training. So a homeopath is really only trained in homeopathy because that's all they do, right? You do homeopathy. A naturopath, in contrast, in many places, this does depend slightly on their scope of practice wherever you are, but in general, naturopaths are considered primary care doctors. That means they're trained in the conventional care model. They know how to do lab work and how to read lab work. They can diagnose you. In some jurisdictions, they can prescribe prescription medication as well. So in Ontario, for example, some thyroid medication you can get prescribed by a naturopath. The nice thing about a naturopath is that, they can act as a bit of a mediator between sort of the alternative care model and the conventional care model because they're trained in both. Homeopaths can't really advise you on a diagnosis or on lab work. They may have extra training in both and be able to talk about it, but your run-of-the-mill homeopath probably won't be able to, just because it's not part of the training. It doesn't have anything to do with homeopathy, so why would it be part of the training, right? Knowing lab work doesn't make you a good homeopath necessarily. So then the third major difference to me between a homeopath and a naturopath is this idea of prevention. So I think naturopaths are probably probably some of the best, if not the best, practitioners when it comes to prevention and lifestyle. So if you have a family history of diabetes and you want to make sure you don't end up like your family members, for example, naturopath is fantastic. But with homeopathy, something has to be wrong, unfortunately. So homeopathy, you only prescribe based on symptoms, so you have to have symptoms to prescribe on. Now, it doesn't mean that there's no place for prevention in homeopathy. So let's say, for the diabetes example, maybe you've got mild diabetes, you've got a few very small minor symptoms. Homeopathy can help you reverse that or prevent it from getting worse. But if you have zero symptoms, then it's gonna be a little bit harder or impossible to treat it with homeopathy, because homeopathy really only works on symptoms. All right, so I hope that was clear. I hope that made sense about what the differences between the two professions are. Like I said, I know they're similar, and so that it can get confusing. So hopefully this lets you know which one is best for you and your care in the future. All right, and do remember, you don't have to necessarily choose between either one. Some people will have a naturopath and a homeopath for their own healthcare. That's fine. They both have different strengths, right? And some people prefer one over the other. It really is just personal preference. So don't be afraid to experiment and try things out. Okay, till next time.